So a lot of the urinary symptoms, or even some of the systemic symptoms like lack of sleep, irritability, may start happening during perimenopause.
Maybe you can explain what we should expect hormonal change-wise as we age. What is healthy and what isn't healthy?
Well, I think that most women don't appreciate the fact that in the 10 years prior to menopause, you go through something called perimenopause. And
Hmm.
during that time, you may have periods of time where your estrogen levels surge, and you may have periods of time where your estrogen levels are much lower. And so a lot of the urinary symptoms, or even some of the systemic symptoms like lack of sleep, irritability, may start happening during perimenopause. I see a lot of women who, never got urinary tract infections, and then suddenly around age 45, they're getting postcoital UTIs, and they're saying, well,
Hmm.
this is weird. It never happened to me before. And I think that those changes are actually starting before you go through that menopause transition, which is defined by when you don't have a period for
Hmm.
1 year. And so a lot of women aren't expecting that before they actually go through menopause, they may start experiencing some of the manifestations of the fluctuations in estrogen. The other thing when it comes to genitourinary syndrome of menopause is that a lot of women will say, "Oh, but I went through menopause 10 years ago." Like, the transition is what we associate with things like
Hmm.
hot flashes or irritability, or those other systemic symptoms. But when it comes to the genitourinary syndrome of menopause, that actually progresses over time. So the vaginal dryness, the vaginal irritation. Some women feel, itching. Some women notice, severe pain with intercourse, like it
Hmm.
feels like razor blades. Intimacy is very difficult. And so I think it's important to recognize that the vagina needs estrogen. And unfortunately, when the Women's Health Initiative study came out in 2002, everyone became really afraid of estrogen.
Hmm.
And it's so important to recognize that using local estrogen, I mean, this is like your multivitamin for the vagina. So using local estrogen is not the same as taking hormone replacement therapy. When you take hormone replacement therapy, you're really increasing your blood levels of estrogen basically back to, like a premenopausal woman. And hormone replacement therapy is beneficial in many ways for appropriately selected people. But using vaginal estrogen is extremely safe. It's not raising your blood levels of estrogen back to a premenopausal state.
Hmm.
And there's like very few people who can't use it. And we even even in women who are breast cancer survivors, we'll use like a very low dose, like Uvafem, twice a week if they're, having symptoms. In many women, the benefits outweigh any potential risk.
Given the kind of symptoms start in perimenopause and it can be 10 years earlier, is that the time when you should start using some kind of estrogen therapy, or do you wait until it's kind of a definite issue?
Yeah, I mean, I think that, if you're noticing that you're starting to have, get urinary tract infections after intercourse, or you never really had them in your life, and now, in a year you've had one or two, or you're noticing that intercourse is slightly painful, you're not lubricating as well, you feel any sort of increased awareness of your bladder or urethra, I do think that it's beneficial to start it early. And if you have none of those symptoms, then no, then it's fine. But I would sort of have a low threshold, like at the sort of subtlest of symptoms, I would say, okay, start using it.
Hmm. Is the dosage different depending on what the issue is you're trying to address? So if it's for recurrent UTI, is it different to if it's just for dryness or itching?
Not really. You know, what we're sort of taught to recommend is like, for example, if you're using estrogen cream like estrase, that you use 1 gram every day for 2 weeks, and then after
Mhm.
that twice a week. I think tends to be confusing for some people. And so in my patients, I just have them use it 3 times a week. In some women where I'm not seeing enough of an improvement, if a woman has really severe atrophic vaginitis, I'll say use it every day or every other day
Mhm.
until I, re-examine you. So, I mean, I might change it based on, what the exam looks like or how they're responding, but I usually start out with, I would say like a standard template of like 3 times a week. And that works really well for most people. There's a lot of women where they'll get prescribed estrogen cream by their gynecologist or urologist, and they don't have a sufficient conversation about it. So when
Mhm.
they get the tube, it comes with the same warnings as systemic estrogen. So,
Right.
it'll say like may cause heart attack, stroke, all this stuff, breast cancer, uterine cancer. And it's really scary. So I think it's really important to recognize that local estrogen is very safe, and there are no studies that show that it increases your risk of cancer or thromboembolic events.
Mhm.
And then yeah, I think you use it to the extent that it works.
Mhm.
So some women might need to use it a little more often, and some women use it 2 or 3 times a week, and that's it, and they're fine.
How soon should you experience benefits from it if it is going to work?
So that's a great question. And I think that that's a reason why a lot of women stop using it,
Mhm.
because it does. It's actually changing the architecture of the cells in the vagina. And the vaginal cells need to be rich in a substance called glycogen in order to promote the growth of healthy bacteria,
Mhm.
which is lactobacillus. And it actually takes about 3 months to change the architecture of the cells. And if you stop using it, then the effects go away. And I think a lot of women start, they'll use it for the first couple of weeks and they'll say, oh, this isn't doing anything. And so
Mhm.
they stop using it. Or, I see a lot of women who were told to use it because they're getting recurrent urinary tract infections. And then they say, yeah, I stopped using it because I got a UTI. It didn't work. And I
Right.
think, you have to really think of it literally. It's the multivitamin for your vagina. It's what you're just going to use every day to keep the tissue healthy, to help promote a healthy vaginal microbiome. And it's not something that's like taking Advil or Tylenol where you're going to feel this immediate relief of
Mhm.
symptoms. You have to use it over the long term.
And long term, does that mean basically for the rest of your life?
I think so, yeah, because I think, where our guidelines tell us, use it for the shortest duration possible. But I see women where when they stop using it, they develop atrophic vaginitis again and their symptoms come back.
Mhm.
So I recommend, continuing to use it. I tell my patients, look, if you go on vacation or something and, you don't have the tube with you, or there's a lag between getting your script, like you go a few weeks or a month and you stop using it, it's okay. But, in general, once you stop using it over a long period of time, the same issue that you had before, is probably going to come back. So it's best to just continue using it with reasonable consistency.
Mhm. Is the advice you give to women at this point of life different depending on whether they are or are not still sexually active?
Yes, because, there are some women who I examine, who, have signs of atrophic vaginitis, but they're not sexually active. They don't have symptoms from it. And if they have no complaints or issues, then yeah, I would leave it alone. But if I see a patient where they are having irritative symptoms, they're getting recurrent UTIs, or even in women who have stress incontinence, and their problem is not necessarily pain, their problem is more like leakage of urine.
Mhm.
Um, I still use it because it really helps to boost a healthy collagen and vasculature around the urethra, which helps support the urethra.
Mhm.
And so, I think for female lower urinary tract conditions, it's important.
Okay. Are there circumstances where you would use testosterone or progesterone as a local treatment?
Testosterone, yes. I think, we talked about women with Skene's gland
Mm-hmm.
irritation. I've actually seen a couple of cases of like clitoral phimosis, where I'll use a combined estrogen testosterone with that. And topical progesterone in the vaginal area, I don't use. I use progesterone orally for
Mm-hmm.
women who are having issues with menopause, and progesterone is really wonderful to help with sleep.
Mm-hmm.
So I'll prescribe it to take at bedtime in women who are having issues with sleep during or after menopause. And then the other thing that I like intravaginally is intrarosa, which is it's called prasterone, which is intravaginal DHEA, and that's like the steroid precursor to estrogen and progesterone. And that's something that you use once a night for 3 months. And I find that it works well, and it's a suppository, and the suppository also has a nice emollient.
Mm-hmm.
The way they've formulated the suppository, it actually acts as a nice moisturizer as well. So yeah, so there are cases where I'll use a little testosterone, and that's something I have to have compounded, and then there are cases where I'll also use the DHEA.
Okay. And another question on hormones, not so much to do with therapy, but a question comes up a lot. Is it possible that this certain stage of my menstrual cycle is causing my UTI? So people explain that they get a UTI every time they menstruate or every time just before or after. And some people say it happens only when they ovulate. Can you explain the link there and what might be happening with those people?
Well, it's interesting because I think that a lot of women develop urinary symptoms, which are cyclical. And I think if it's actually a urinary tract infection, it may have to do with changes in the microbiome. Some women, during menstruation, if they're like using a tampon or something like that, you can certainly get like BV,
Mm-hmm.
bacterial vaginosis. You can get overgrowth of bacteria when there's a lot of blood, which is nutrient rich in the vagina. And so I think bladder symptoms can certainly be cyclical. And if it turns out that it actually is a urinary tract infection, then it most likely has to do with changes in the vaginal microbiome at that time that are making you more susceptible.
Okay. Are there certain symptoms that you look for that might indicate something else is the cause when it is cyclical like this, like endometriosis or another pelvic condition?
Yeah, that's a great question. So certainly, yes, women who tend to have more pelvic pain, urinary symptoms, and we talk about the fact that the culture, our urine cultures aren't necessarily sensitive enough. But if you're seeing, for example, like no white blood cells as well on the urinalysis,
Mm-hmm.
then I think that's an indication that it's not necessarily an infection, that it could be something like an endometriosis. The patient's history. So, for example, somebody who has an extensive smoking history, I'm very concerned that we have to do a cystoscopy and we have to rule out bladder cancer or carcinoma in situ, which can be the cause for irritative symptoms.
Mm-hmm.
And then, of course, patients who have interstitial cystitis can also complain that their symptoms are worse based on where they are in their cycle. Also I have a very low threshold to do a cystoscopy and see if there are any specific bladder findings. The other thing is when patients are having those symptoms, a big thing for me is like, one of the first questions I'll ask is, well, when you take antibiotics, are your symptoms getting better? I think that's a big clue as to
Mm-hmm.
whether this is an actual infection versus something else.